Hey everybody, we are going to do something controversial today. We are going to do a COVID-19 test to see if I'm in fact positive. If you like what we drop here, please hit the subscribe button. And if you click that little bell, every time we drop a video, which we do 3 times a week, you'll get a notification. Dr. Jeff Barke is about to glove up, draw some blood. I'll find out if I'm positive. Here we go. Hey everybody, I'm excited because I've got a second chance to sit down with Dr. Jeff Barke and do another interview. Thank you for doing this.
My pleasure. Thanks for having me, Brad.
He is an awesome medical doctor, and what we decided to do today was actually have the COVID test done.
Heck yeah.
All right.
Let's do it.
So what I'm going to do is have him test me, and I'm sure it's a super elaborate test that's probably going to take many days to get done. Is that remotely close?
Well, maybe many minutes, but not many
minutes.
days.
So here's the thing. A lot of people are really afraid of the COVID virus, and do I have it and don't I? And they're locking themselves in for extended periods of time, and we'll get into those details of what you can do to help yourself out. But I just thought, let's just take the mystery out of it. If the test is 10 minutes, then you can find out one way or the other if you've been exposed, if you have the antibodies, and it changes the way you live and approach life, and you can do without the fear, then I think there's a lot of health value in knowing that as well.
I totally agree. We've been doing literally hundreds of these in my office, and a lot of them are for people that were ill December, January, February, and they want to know, was that illness the coronavirus, et cetera, or folks that are going out, for example, it's Mother's Day on Sunday, and they're going out to visit mom, and they want to make sure that they're not in a position where they may accidentally infect an older mom or grandma, et cetera. So they're coming in and being tested for that. And you know, it's sort of this mystery thing, and I thought it would be a fantastic idea. Let's just test you live on camera, and you'll see how easy it is,
Right on.
and how quick the results are. And with a little luck, you're negative. Actually, even better, if you have memory antibodies, then you can wear your Superman cape around.
And I love that, because if you do have the memory antibodies, then I've been exposed, and technically my immune system's built up, and they should allow me out of lockdown.
That's right. We ready?
Let's do it.
All right. Give me a finger.
Uh-huh.
And don't worry at all. This won't hurt me a bit.
Oh, famous last words, right? Right, just before you get plucked. Oh God.
I won't feel a thing. So this is like a,
You won't feel it.
this is just like a diabetic that tests their blood sugar daily, multiple times a day. So this is a little lancet for the tip of the finger, and it's super easy. And you barely feel anything. You can see a little drop of blood forming there. So we take a pipette and we draw up that blood, and then we put it right in the cassette there. It only takes a little drop. We're going to squeeze this thing to get more blood out. At least it's red, right?
That's good.
It's not blue blood.
So what's cool about this is there's different kinds of tests. I think that's important to point out. But in 10 minutes, if I've got the memory antibodies, then technically I would have been exposed. My body's already built up.
I'm going to let you push on that with a piece of cotton.
Cool.
So we have a drop of blood right on the cassette. We take a couple drops of reagent. This is called an ELISA test. Enzyme-linked immunosorbent assay. I think that's what ELISA stands for. So we take 2 drops, and we put it right where the blood was.
Cool.
There's 1, there's 2, and that's it.
All right.
Now we set our timer.
Cool.
So 10 minutes is all it takes, and we'll see a little line form where the control is to let us know that it's working, and then there's a place for an IgM antibody. The IgM antibody is the acute antibody. That would indicate that your body is currently fighting something off, whether you have symptoms or not. Then there's the IgG antibody. That's the memory antibody. That means you've been exposed to something in the past. Your body has created memory antibodies. It's like a standing army that's waiting for a virus or an enemy to come in, and it's ready to fight. And then we'll know.
Awesome. So you did a talk a couple days ago from the steps of one of the Riverside hospitals.
That's right.
It's been getting a lot of play on social media, Facebook. You stood there in front of a microphone and just basically threw down some truth. And there's a lot of healthcare providers cheering them on. What are some of the things that you shared there? And then while we wait the 10 minutes, let's jump into some details
So
on
we can
what's
see
going
the
on.
control line that came up. So that means that the test is working. It's a valid test. There's enough blood. There's enough reagent. So on the steps of the Capitol, I mean, it was really spontaneous. I didn't have anything planned, and I just wanted to speak the truth to those that were out there trying to convince the city council members to open up their city of Riverside. And one of the things I think people forget about is while we're in quarantine, while the unemployment rate is literally hitting 30 million, actually it's over 30 million now, it's getting close to depression levels of unemployment, is that people are really hurting, and not just hurting because they don't have money, but their health is being hurt. So never before have we seen so many numbers of suicides. The highest suicide rate in the United States was during the Great Depression. We're getting close to depression levels of unemployment right now. We're also seeing tremendous increase in domestic violence calls to 911. Child abuse calls, drug abuse, mental health problems, etc. So there are real people hurting. There was an article that just came out a couple days ago from Ontario, Canada, where there are 30 people that were waiting to get heart surgery that was delayed because it was deemed non-essential, that died as a result of not being able to get the surgery because 30. I have a patient, she actually lives right down the street. She's waiting to get knee surgery, really bad knee pain. She needs knee replacement surgery. It was on the books, scheduled actually, I think, for a week or two ago. It was delayed because it's not essential. And now what is she doing? Well, besides not being able to walk and get around very much, she's taking more Vicodin for the pain. Now she's got a Vicodin problem because she's required to take more and more medication because it's very, very painful. And I hope the surgery works. So what we're going to see happen as a result of delayed surgeries for many people is we'll have permanent disability as a result of those delays.
And if you look at pain medications, the opioid category, huge epidemic in 2019, last year, kind of reached a fever pitch where 1 in 3 children in California that are in orphanages and foster care are there because either their parents overdosed from opioids and they passed away, or they're in drug treatment programs. So 1 in 3 kids are affected from the pain medications.
That's right.
And it's kind of a domino effect.
That's right.
80% of heroin users got started on opioids, you know, and so there's other collateral damage, I think, that needs to be looked at as we continue through this COVID quarantine lockdown. There's other health ramifications.
You're absolutely right. And speaking of the children, the UN came out with an estimate that they expect somewhere around 200,000 children to die as a result of the poverty that was induced by this economic collapse and this voluntary economic collapse, if you will, worldwide. So these are real deaths, these are real things, but we don't see that on TV. We don't see that in the mainstream media because it doesn't play into the fear-mongering mainstream media narrative. So even after, let's say, a month or 2 or 3 from now, once we're opened up, we're not going to see studies and surveys about the suicide rate or the injuries that occurred because of delayed surgery and so forth. We won't see that.
Right.
So right now what we see on the mainstream media is every single night, the sky is falling, the sky is falling. It's horrible. I saw a report the other day that we might be able to get COVID from our dog. You know, the dog could shed this and so forth. And then immediately we start getting phone calls, etc. They never tell us any good news. They only blow up the bad news. They exaggerate the bad news. And then they poll the people and say, hey, by the way, are you scared about this?
Right.
And do you want to stay locked in? And they go, yeah, because you've been telling me the sky is falling and it's a horrible thing. So no wonder people are scared.
Right. So to be clear, can you get it from a dog?
Because
Because we have somebody at our local dog park that swears our dog Riva is, you know, could be a potential carrier. It's like, are you crazy? But at the same time, I want to kind of take some of the fear out of it, which is why we're doing the test, which is why we want to give you some things to do to boost your immune system, but also look at this from the perspective that there's collateral damage, 30 people that didn't get the surgeries, people that are prolonging surgeries. And Jeff and I have talked about this before. One of the great things Dr. Barke can illustrate is just because it's non-essential, that's an insurance industry term that they say, look, you don't really need this, you're opting into it.
It's an arbitrary term.
It's an arbitrary
So
term.
because you tell me, Brad, how exactly could a surgery for my patient with a knee be considered non-essential, but an elective abortion, for example, be essential? How is it that a liquor store is considered essential, but going to church is not essential?
Right.
You know, so how is it that a pot dispensary is essential, but you know, a gun store is not essential, especially as they're opening up some of the jails to release criminals. So we've got it backwards and we've got it wrong. The government, in my opinion, has way overreached. When they write history books about this period, I don't know, 20 years from now, they're going to look back and I believe they're going to say the induced cure was worse than the disease itself.
Wow. The induced cure was worse than the disease
And
itself.
by the way, so we're about 10 minutes in, and we can show this to the camera. So we see the bright line there, and I don't know if we can see this. It'd be kind of cool. There's a bright line at the bottom. That's the C or control line. That means this was a good test. The reagent worked. The diffusion paper worked. And there is no line where the IgG or the IgM antibody shot is. And so congratulations, I guess, you're negative.
Cool.
That's the good news. The bad news is I would love to have been able to tell you that you have memory antibodies.
Me
You could
too.
wear your Superman cape.
That's right.
But that's not the case. But if you're visiting mom or somebody old this weekend, you're fine.
Okay.
You're not infected, and you don't have current virus, and you don't have memory virus.
All right.
So you should be good to go. But you can see how easy this
Totally.
is. Yes, sorry about your finger. I know it hurts
Oh,
just
no,
a titch.
I was, yeah.
And it's simple, and in 10 minutes we have really good information. The other nice thing about it is it's relatively cheap. So to the extent that you're out and about in the public or you're an essential worker, thank goodness I get to still go to work, you can test somebody frequently because it's not very expensive, it's very easy to do, and most importantly, it's quick and it's accurate.
Yeah, it really isn't painful at all. I mean, it was just a little tap, and that was it. And then basically a drop of blood on there, and 10 minutes later, you know. And I think, again, the stress of that would take so much out of it. Now, there's a lot of people waiting for this vaccine to be rushed out in a couple of months. Can you tell us what a typical vaccine would take and kind of why this fast track thing also should have some people concerned?
Absolutely. Now, first of all, I'm often accused as being an anti-vaxxer. So at every rally I go to, there's always one person with that big sign, vaccines hurt you, and blah, 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 and so forth. And so everybody in the audience is labeled as an anti-vaxxer.
Right.
So I'm not an anti-vaxxer. I think vaccinations can be very helpful, but what I am anti is I'm anti the government mandating a medical procedure. So for example, if you were to come in and you had a funny skin lesion and you wanted me to take it off because we were concerned it might be skin cancer, I'd have you sign an informed consent sheet. It would say, these are the risks, these are the benefits, these are the potential complications. Are you good with that? Sure. Sign here to acknowledge that we had this conversation. If you came in and said, I need to update my tetanus shot, or I want a seasonal flu shot, or another vaccination, no such consent is required. We don't give you the package insert that's written in 8-point font. You just assume that whatever it is that we're recommending is going to be perfectly okay. For the most part, I think vaccines are fine, but I think they should be given with proper informed consent, and the government or any other body should not be mandating that you must have a needle stuck in your arm or you won't be able to do some sort of activity.
Yeah.
So vaccinations, I believe, are good. We should educate and promote them, not mandate them, because as soon as the government starts mandating something, you immediately start getting pushback, even from people that aren't anti-vaxxers.
Right.
So my concern about the COVID vaccination is usually it takes several years to come out with a vaccination. And President Trump told us he expects one by the end of the year. He may or may not be right, I don't know. But I would be a little bit nervous about a brand new vaccination that comes out with limited testing, and now we're going to volunteer our arm or have our arm mandated that we must be tested. So maybe the vaccination, when it comes out, the end of the year or a year from now, might be a good thing. The studies are still out. We'll have to investigate it. We'll have to look at it closely. But I've already heard that there's some talk about making this vaccination mandated for every person, and I think that's a mistake.
Mandated medicine really moves away from precision medicine.
That's right.
Right, and the idea is if everybody has to do it, well, everybody's different, and there's certain scenarios that you would really want to think twice or give pause for health reasons alone on that. Not to talk, politically about it, but just for health reasons, there's sensitivities, there's reactions that people could have had in the past that wouldn't be a good idea. But let's talk about untested or maybe a rushed test in a couple of months versus a couple of years. Typically in science, the longer the timeline, the more we know about a thing.
Sure, the longer the timeline, the more people that have gone through clinical trials and so forth. I mean, I know there's clinical trials going on right now if we push this vaccination to the market, it's going to be based on limited clinical trials. I mean, keep in mind, remember the swine flu a bunch of years ago? That came out and it was a vaccination that was contaminated. It ended up hurting a lot of people with Guillain-Barré syndrome as a result of the vaccination. So there's a sensitivity about getting something that hasn't been true and tested. That's not to say that the vaccination when it first comes out is not going to be good. I don't know. We'll have to study it carefully. We'll have to look at the data. But right now, we don't have a vaccination. We can't wait for a vaccination to open up our states and our country. So we need to move forward with what we have now.
And I think limited data, we don't know. It's all very fair to say that. And given on a longer timeline, we might be able to change that position. But to mandate something when you have limited testing and limited availability, and now you're going to step on people's freedoms, that's the part I totally agree with you.
Absolutely.
I just go, not a good idea. If you've got limited information, but we're going to extrapolate this and mandate this, man, that is a slippery slope. And
no doubt about it.
Yeah, the minute you mandate something, get pushed into somebody, especially with a vaccine, you go by the natural immune system, natural immune defenses. And this whole interview really is about science. I wanted to do the test and go, look, it's easy. We take the mystery out. A couple minutes later, the test hasn't changed. Now I know, and you can know too. With the vaccine, get the test, look at the data, and give it due process instead of rushing it and mandating it. I think that's a dangerous combination.
Absolutely. So let's talk about a little bit of good news. I know
Cool.
you're into natural health,
Yes.
and trying to help people maintain their natural state
This
of
is
health.
why we like this guy a lot.
So
Yes.
here's what we know, first of all. Most importantly, take good care of yourself.
Right on.
If you're in good health, if you're eating clean, if you're taking some basic supplements, if you're reducing your stress, you're in a much better position if you come in contact with this virus to survive and do perfectly fine. And there's some good evidence to support this. So for my patients, I am routinely recommending supplements for them to take. Cool. Probably in order, I shouldn't say in order of importance, but one of the important supplements is vitamin D. Mm-hmm. So especially since a lot of people are paranoid about going out in the sun, they don't want to get skin cancer, and I get that. Their vitamin D levels are routinely low, and we order them on our routine blood tests. So we need to boost that vitamin D level up to at least the normal range. I like it even higher, somewhere between 40 and 70. Above 30, it's considered normal, but I want that number even higher. So vitamin D, number one.
And that's a building block for your immune system. If it's not there, then your body's just running low. And the reason you mentioned the sun is that's a natural building block. It's a fancy term. It's a tocopherol, basically, you get from the sun. But it's a building block your body needs to have to do the rest of what it needs to do.
Yes, the other vitamin, the other supplement that's shown some benefit is vitamin C. So as a matter of fact, there's actual protocols for hospitals. IV vitamin C is part of the treatment for COVID-19. And the reason why is we believe one of the major problems that this virus causes on the body is a massive inflammatory reaction. And so vitamin C, low-dose heparin, methylprednisone, etc., to quiet down the body's inflammatory response so the immune system can fight off the virus. So vitamin C, I think, is another important element, supplement. The other is zinc, and that's not talked about much. So we know with hydroxychloroquine, which is a common treatment now for it, even though there are those, World Health Organization, even our own CDC, that's suggesting that it's a dangerous drug. I just say that's nonsense. We have literally hundreds of thousands of people right now in the United States that takes daily hydroxychloroquine for a variety of different autoimmune diseases, rheumatoid arthritis, systemic lupus, etc., and they do just fine on it. And when we're talking about a short course of hydroxychloroquine, 6 to 7 days, I think it's perfectly safe. Yes, check with your doctor. Yes, make sure you don't have some underlying heart ailment. But I think combined with zinc, combined with zithromycin, Z-Pak, purpose of that is zithromycin has some anti-inflammatory properties as well. Plus, one of the complications of getting this virus is bacterial pneumonia. So the zithromycin helps treat and prevent that. The zinc is very effective at basically grinding to a halt the virus's replication mechanism. So I've talked to infectious disease doctors that are using this routinely around the country, despite the fact that the media will flash on the screen, this study that just came out that showed these people died, this study that just came out that showed it's not effective. They don't tell you about the thousands of doctors that are using it successfully. And then when there's a successful story, there's a doctor in France. It wasn't double-blinded, but it was a very good study that showed wonderful benefits. Of course, they bring that forward and then they immediately find an expert to tear that study apart.
Right.
Fear and unfortunately drama is what the mainstream media loves to present.
And the World Health Organization's kind of in a funny spot on this particular topic.
Oh, they're not
COVID.
in a funny spot. The World Health Organization on my list is a notch below the UN as far as credibility. Let's keep in mind the World Health Organization was parroting the Communist Chinese Party's propaganda in middle of December when the Communist Party knew that this virus was able to be transmitted person to person. Mm-hmm. Yet the World Health Organization continued to parrot their propaganda that wasn't the case. You know, these aren't the drones you're looking for. Move along. Mm-hmm. And later we find out that they knew, and yet they didn't report.
Australia wants to launch a private investigation into the World Health Organization. The way they're handling COVID, President Trump has pulled the funding to the World Health Organization. Yeah, when I say there's some funny things going on, again, we're starting to move away from science and get into agendas with drugs, and they're putting this drug down from the World Health Organization, and it's raised a lot more questions than it's given answers. And you go, hey, look, all things being equal, there is a track record with this drug. There is proven results with it. And all of a sudden, we're starting to get really conflicting information. I think it's becoming really obvious that the science isn't running the agenda with COVID, right?
That's right.
It's a lot of people starting to flex muscle, governors and things that I'm not trying to make this a political conversation, but it's really getting into our realm, which is healthcare. And
it's unfortunate it's become a political conversation. I mean, you don't have to agree with me.
Yeah.
And that's fine. I'm perfectly okay if you think what I'm saying isn't correct. That's fine. I think it is correct. There are other opinions out there. Fine. But the problem is YouTube and Facebook want to ban my videos. So I say some words on the steps in Riverside, and immediately now I'm threatened, right? So I'm threatened. My family is threatened. I'm called names. There's even a post that was hoping that I'd catch the virus and die. It's just unbelievable. This is the tolerant left that now is personally attacking me because I have a view that's different than the mainstream narrative that's being presented.
And we just want the facts out there, the tests, the research, the timelines it takes for vaccines. People need to know what the norm is. People need to know what is standard protocol, and we've moved so far away from that. I don't want you to be a victim to the media hype. I don't want you to be living in that constant state of fear. That is stress response, and that decreases your immune response. So it's one of those things to stand up and speak up is taking more courage these days. And
Absolutely.
I really appreciate you doing this. Thank you for jamming me with that thing to get some blood. And if we look at the test, it hasn't changed at all.
No, it hasn't.
So the idea is now I know, and this is what we want to do for you, is just give you the facts. You can decipher it for yourself. But there's more things working for you than against you at this point for the length of time this has been going on. I would look at this as an optimistic point of view.
Yeah.
Right. So it is, whether it's phases they release quarantine, or you're in a state that just says, hey, you're free to go, or a part of the world that hasn't even put people in any sort of lockdown, you really need to start taking care of your body. Vitamin D, vitamin C, start looking at things that you can do naturally. But stress in the media is not going to be good for you, right? So those are things that are super important. Where can people find and follow you?
So they can find me on Instagram at RX for Liberty, RX for Liberty. That's my new Instagram site where I'm posting all my material, so I'd appreciate you going there and looking at it. Here's something that's really important though. You know, people are emailing me and texting me that I'm some sort of a hero. I'm not. I'm just an average guy, man. I'm just an average guy like you. I put my pants on one leg at a time, and I've home married 30 years. I got 2 kids. I'm just an average guy who has had the courage to speak out. And I would encourage you to do the same. Peacefully, politely, but don't be afraid to speak your mind, and don't be afraid to support those that are speaking out for you as well. So get out there and do your thing and be brave. Most importantly, take care of yourself. Communicate well with your local doctors and healthcare providers. Find out if supplements are right for you. get tested if you have access to that. And thanks for having me.
He is a hero. He's being humble, and what's really cool about it is, anything that's mandated in healthcare, anything that's forced upon people against their will, this is what America was founded on. And honestly, I think when it comes to healthcare, this is an area that you and I are really passionate about. I'm a chiropractor. I am not a medical doctor. I don't pretend to be one on television. This is why I wanted to bring you in to share some of these ideas, but also to let people know this is where you need to find out what's the truth. And if this resonates with you, support Jeff and give him some love. Put some comments down below what your favorite soundbite of this was, what he said that resonated with you, because recently he has been attacked. And when he's laid out the science and information, they've censored it. And to me, that's also got to raise some questions, right? Like, if these are scientific facts and these are, research articles that are out there, but it's being censored by Facebook and YouTube, then why is that so threatening? And ultimately, I want people to decide for themselves and just put the facts on the table.
What do you say we do this again in a couple weeks?
I love this guy.
And now that I know you're negative, I can shake your hand.
Dr. Jeff Barke, he is an American hero. Thanks for joining us.
Thanks.